minutes or so with me. Hi, everybody. How are you? Thank you for spending the next 45 minutes or so with me, where we're going to be speaking about movement, optimizing our movement, and how we can do that living with chronic disease by understanding how our body relates to the ground. So my name is Dr. Splichal. I am a functional podiatrist and human movement specialist in New York City. And in addition to practicing podiatry, I am an educator. I travel all around the world teaching other doctors and specialists about the feet and barefoot science. And in addition to that, I've written several books, and I'm an inventor of a product called Naboso technology, which I will mention a little bit into the conversation today. So now, real quick, my background. What I want to share with you is that I build my practice around the importance of movement and how we can optimize our movement, why it's important for us to optimize our movement. And really, I see the day-to-day walking as the life force of what feeds a lot of our connective tissue, what decreases a lot of our chronic pain, what stimulates the nervous system, what stimulates the brain, what keeps your emotional regulation under check. So to me, movement is the foundation of life. I actually often use a quote that says, "Movement is life and life is sensory." So I'm going to be speaking to you today about movement, life, and sensory. So my practice and a lot of what I focus on when I write and do consulting is various chronic conditions. My practice as a podiatrist, I see a lot of chronic neuropathic pain, but I also see a lot of chronic movement imbalances, a lot of movement disorders, and then various chronic connective tissue disorders. And they're coming to me maybe not because they even have foot pain, but because they're trying to understand how they can optimize their movement by understanding this foot-ground relationship. So walking is the most foundational movement that we do every day. On average, we take probably 5,000 steps a day. I live in New York City, where a lot of my patients take 10,000, 20,000 steps a day. So it's a lot of this repetitive movement pattern. And the underlying tone of walking and day-to-day movement is that we have this constant foot-ground relationship. Every time your foot hits the ground, the way it hits the ground can feed each successive step and the quality of that movement. So I want you to be thinking of, how can I optimize my foot-ground relationship if I want to improve my gait, if I want to improve my balance, if I want to reduce my falls? All of those are critical answers when it comes to optimizing movement. So now, whether you have fibromyalgia, or you have MS or Parkinson's or a stroke, or maybe you have idiopathic neuropathy, whatever it is, all of us can optimize our movement by understanding sensory information and how the brain processes movement. So let's get started a little bit more into the science of it and how we can break down this process. So walking. Key point takeaway here already. Walking is the most foundational movement that we do every day. So the baseline function that you want to make sure that you are restoring in your life is the ability to walk, the demands of walking, and the demands of walking as it relates to sensory information and the nervous system. Now, the way that your brain or your nervous system maintains balance or is able to walk is based off of sensory input. The 4 sensory input systems are your eyes, your ears or your vestibular system, your joints, and then the skin in the bottom of the feet. So again, we have eyes that are processing information, vestibular, meaning sound, but also the inner ear and the fluid of the inner ear, and then joints. So every time you move a joint, you stretch it, and that stimulates the nervous system, and then the skin in the bottom of the feet. Now, what's interesting is that if you take away one of these 4 input systems, the nervous system is so intelligent that it upregulates one of those other 3 input systems. Let's give you an example. Let's say that we are we start to get an inner ear infection. Maybe we have vertigo. And so we have a decrease or a deficit in one of those 4 input systems. Your body is going to upregulate and most likely will pull a lot of that information out of the joints or the joint capsule. How can you feel this? How can you understand this yourself? If you want to, maybe not now when I'm speaking to you, but try this little experiment when you have a moment. I want you to stand, and you're going to stand either on one leg, or you can be in kind of like a kickstand or tandem. And then I want you to just stand and test your balance. See the way that you're feeling. You might feel great. Now let's see what happens as soon as we shut our eyes. Now, if you have any decrease in your balance, I want you to hold on to something the entire time. Just hold on the back of a chair, have your hand on the wall, something so that you're stable, but you will still notice this difference. So we're going to take away one of the input systems. And then as soon as you do that, do you notice that your joints, your ankle starts to do this, right? Like a wobble, wobble, wobble. That's considered noise. So that noise is sensory input. And what happened is that you took away visual, your nervous system upregulated your joint capsules, the proprioceptive, and the more that the joint moves, it's pulling more information into the nervous system. Great example of how intelligent or protective your nervous system is. I think one of the key concepts is to understand that our body is very sophisticated around the basis of survival. Yeah. So that means that if you take away one input system, it wants you to survive. So it's going to be intelligent enough to over recruit and bring in more information from these other input systems. As a podiatrist, I focus on the foot as the sensory gateway into the nervous system. It is one that is often underutilized and under-accessed because we are chronically wearing shoes. So let's take a little look at the power of the skin in the bottom of the feet and how important it is and how you could use this access point to optimize your movement. So palms of the hand and the bottom of the feet have special skin and special nerves in it. So this is called glabrous skin, where the skin outside of your hand is called hairy skin. So hairy skin, glabrous skin, different type of skin. Here we obviously have more sweat glands. We do not have hair follicles. We do not have melanocytes, which are the cells that create like a tan or a pigment. So very different. Here, obviously, you notice different things, right? There's hair follicles, there's melanin, you can tan, okay? The nerves are also different. The nerves of the palm of the hand and the bottom of the feet are called mechanoceptors. They are sensitive to different stimulation. I'm going to tell you what they are. So the 4 stimulation that comes in from the bottom of the feet and the palm of the hand, there's 4 main things that you can focus on. The first one that it's sensitive to is texture. Texture or 2-point discrimination. Best analogy of where you feel texture from your hands would be braille. So the next time you're at an ATM or anything in a public setting where you can see the braille, just look at the braille dots. The height and the distance of those braille dots are stimulating a special nerve on the tips of your fingers. Your feet have those same mechanoceptors. Another stimulation that your feet is sensitive to is pressure, skin stretch, and then one of my favorite is vibration. So you bring in texture, pressure, skin stretch, and vibration through the palm of the hand and the bottom of the feet, and then your nervous system uses that specific information to help you maintain your balance. Maintain your balance when you are walking. Some really cool facts about the skin in the bottom of your feet is 70% of the nerves in the bottom of your feet are sensitive to vibration. 70%, a majority of the nerves in the bottom of the feet are sensitive to vibration. We use vibration to know how hard we are striking the ground, but we also use vibration to maintain our balance. Now you might be asking yourself, where do you encounter vibrations in your day-to-day movement? You encounter vibration every single time your foot hits the ground. So the foot hitting the ground creates vibrations. And that's actually how you know how hard you are hitting the ground. Oftentimes when I teach or I explain it to patients, I want them to really understand this. And a lot of people think of it as pain. Like when I hit the ground, it creates a pain, and then I know I'm hitting the ground. That's actually not true. It's vibration. So we need vibration. We need to be able to feel vibration to maintain our balance when we walk. I want you to think now, what happens to vibration when you put cushion in your shoes? Just think for a moment. If you have thick cushion in your shoes and you're trying to pound the pavement, what's going to happen to the vibration? I hope that you are saying that the shoe is going to take the vibration. Now you might say, that's good. I want shock absorbing shoes because I don't want to get hurt. However, if the shoe takes the vibration, which is your information, how do you know how hard you're hitting the ground? How does your nervous system know how hard you're hitting the ground? Or you could say, if I use a vibration to maintain balance and the shoe takes the vibration, how do I maintain balance? It's harder. This is why in my practice, I'm a big advocate of getting my patients out of thick cushioned shoes, especially my patients that have chronic movement imbalances. Even a lot of my neuropathic patients and patients with foot drop, I get them into a more minimal environment. Obviously, I want them to control their movement, but if they're too cushioned and they're too blinded to what's actually coming in, their movements are less accurate. Their movements are slower. Their injury rates are actually higher. And then I'm going to talk about the Noboso insole soon. That is a way to help you connect to the ground more. So let's see if we have a question here. We got some great questions that are coming in, and I want to make sure that we get these topics answered. Beautiful. So yes, we have gravity. I love this question that Christine had mentioned, that gravity is the only constant in this world, the only constant. So if you think of the stimulation that we encounter when we stand up in gravity and we walk in gravity, that is the most important sensory stimulation that you want to put yourself into. We need to be able to control it so we don't get injured. So yes, with the gravity, very important to understand that. Another question is where a barefoot child, my barefoot child has an issue recognizing how hard she's hitting the ground. Yes, so that could be in children. We need sensory input optimized primarily in childhood. That's where we have what's called the peak window of neuroplasticity. So neuroplasticity is when your brain is like open, right? So we are shaping all of these synapses and how the brain is communicating to each other. Brain synapses that fire together, wire together, right? So we really want to open the brain as much as we can during these windows of neuroplasticity. A child's neuroplasticity is from actually in utero to 4 years old is around when the biggest windows of neuroplasticity is. So you want to, for a child, keep them as sensory rich as possible, keep them barefoot as long as possible, introduce them to different textures and surfaces and let them play in this sensory rich environment, hands and feet, so then they can create optimal motor patterns. Let's go to the other side of the spectrum where now we are over 65, let's say, and now our nervous system is getting a little bit slower, right? It's a little older. Maybe we've been in shoes chronically. Maybe we had a stroke or an MS. You want to then go back to how we were as a child and reopen that sensory rich environment to try to optimize neuroplasticity. Neuroplasticity is one of the biggest advances, I think, in the 21st century as far as how we can continuously shape and adapt our nervous system. Vibration cannot be underemphasized or overemphasized when it comes to how we optimize movement. So that is day-to-day movement, barefoot, feel the vibration, think about the cushion that's in your shoes, because again, 70% of the nerves in the bottom of the feet are sensitive to vibration. Yeah, can we get more minimal, or can we get barefoot stimulation into our environment? Okay, now here we go. I got a few more fun barefoot facts for you. Okay, another one. The nerves in the bottom of the feet, their peak sensitivity Their optimal peak window of sensitivity is age 40. By the time you are 70, you need twice the stimulation to create the same response. So what does that mean? As we get older, we need to make sure that we feel the noise of the stimulation through the feet. I would say that as we get older, we should probably make sure that we are not in thick cushioned shoes so that we can maintain that sensation of vibration. Okay, so again, peak sensitivity is age 40. By the time you're 70, you need twice the amount of stimulation to create the same response. To me, it's one of the biggest contributors to falls with age is that we cannot feel the ground. And what we're not feeling is the vibration of the ground. Okay, now again, the other stimulations that we respond to is texture. The other stimulation that we respond to is skin stretch. And then, of course, we have pressure. Great. Okay, so just got to see if we have another question here. So post-stroke with sensory issues. Beautiful. With sensory issues, why am I unstable even if I'm barefoot? Is it because my brain signals are not sensing the feet, not communicating with the feet? I'm going to give you some balance hacks. How about that? So for anyone that is trying to optimize their movement, regardless of what the chronic condition is, and I use this even with athletes and I use this with children, is that we need to understand how to hack the system so that we can balance better. Are you ready? Get out your pen and paper to write these down. Okay, your first balance hack when you are trying to improve your balance or really optimize your balance is first, it is built around eyes. So your eye stimulation. I do balance training, so balance rehab with my patients. When I do that, I want them to optimize their visual input. So I do a lot of visual training with them. But let's say you're standing on one leg or you're in tandem and you're just doing a standard balance exercise. You want to use your eyes the right way. That means to stare at something in front of you and spot it. Stare it, spot it down, take in nothing but that one spot. That is using your eyes in a way that's going to upregulate your balance. Now, let's say maybe that doesn't transfer to function because you always got to walk. So what I want you to do then is to stand in your balance exercise, spot something, stare it down, really stare it down, yes? And then start to open your peripheral vision. So I'm still staring at something, but with my peripherals, I'm not moving my eyes, with my peripherals, I'm starting to take in what else is in the environment. This is not a matter of if I'm holding my fingers over here and I say, oh, how many fingers do I have? No, I want you to just take it in. Appreciate that as I'm looking at the camera here, in my peripheral, I can see that there's an outlet over here, right? I can see that the wall over here is gray. Over here, I can see the window, right? And you're just taking it in. A huge contributor to visual contribution to falls is that we actually lose our peripheral vision. I would encourage everyone to have their peripheral vision tested. What's also fascinating is that let's say we do have a compromise in our balance. So now if I know that I have decreased balance, maybe I've fallen before. Let's say I had a stroke for this example. I had a stroke and now I have, decreased balance. Maybe I fell a couple times. Now I have this layer of fear on top of it. So now I'm scared I'm going to fall again. I don't want to hurt myself. I don't want to, potentially fracture my hip or something like that. So now I'm kind of nervous, right? And when we get nervous, what happens is that your nervous system goes into a fight or flight, a survival mode. And what happens in a survival mode is that your visual acuity goes like this. So now your peripheral vision completely starts to shut down. So we could have double layers to this. Are you starting to have decreased visual contribution to balance? Partly because you don't train your peripheral vision, partly because you are in fight or flight. So it is just your autonomic nervous system narrowing your visual input and taking away the peripheral vision. That's why it's so important to manage your visual input system. Okay, here we go. That was your first balance hack. Second one, write it down. Use the skin on the palms of your hands. The skin on your fingertips primarily is like the skin in the bottom of the feet. It reads the environment, which means that you could, let's say you're doing a balance exercise, hold something. I have my cell phone here, right? I want to hold something. This is in my hand. By having something in my hand, I'm stimulating the mechanoceptors that then feed into my brain and help me maintain balance. You could use a textured ball. There's a ball by Hypersphere, which it's a ball that you could hold and it vibrates. So now we have pressure. Maybe the ball has vibration. Woo, now you have another stimulus. Maybe I want to hold a textured ball, right? Maybe I want to hold a ball that's like tacky or sticky. That's going to stimulate the mechanoceptors differently, but have something in your hand, okay? This is also where if you're doing balance exercises, you actually don't have to hold on the wall, hold on the chair. I want you to just touch the chair, touch the wall, and that will stimulate mechanoceptors. That's 2. Third is that you use what is called tension. So tension is a concept in the body that happens when you create muscle contractions. It's your connective tissue responding to muscle contractions. So let's say to add tension, instead of me, maybe I'm touching my fingertips together, I'm balancing, right? So instead of just touching my fingertips, I'm gonna push my fingertips together. When I push my fingertips together, I created tension. Here's another way. Maybe I want to do a balance exercise and I just make a fist, but I like squeeze the fist. Now I added tension. I want to engage my core, tension. I often teach people to push their toes into the ground, tension. Yeah. So tension in the body creates stability. That's your third. Your fourth is to breathe. So never, ever, ever hold your breath when you are doing balance exercises. Your diaphragm, which is your breath, life force, is connected to your deep core muscles. Your core, guess what, is connected to your feet. So your feet, which is the foundation to your body and connection to the ground, talks to and connects to your center of stability, which talks to your diaphragm. So breath leads to foot core connections. Those are your 4 balance hacks. So I hope that that helps you, Angela, so that when you're maintaining your balance or trying to maintain your balance, you can use these hacks. Yeah? Okay. So we got the bottom of our feet. We spoke a little bit about shoes. We spoke about vibration. I gave you some balance hacks. I'm going to give you now some other tools that I like to help people with chronic conditions maintain their balance when they walk. So there's 2 products. First one is urban poling or the poles. If you've ever seen these, right, and you're wondering like, why is someone using poles like you're cross-country skiing, okay? What using the poles does is that it forces you to have reciprocal arm swing, right? So I'm moving my body on purpose, right? But I want to have this, okay? So now I need to make sure that my arms are swinging. We never want to walk with our arms by our side like a soldier or statue, right? Your arms have to swing. And what happens when your arms swing, I hope that you can appreciate that my torso is rotating, right? I'm kind of exaggerating it, but my torso is rotating, okay? Now, when my torso rotates, guess what? My pelvis rotates. And then when my pelvis rotates, I can take these long steps that allow me to maintain my balance. So arm swing is critical, arm swing, symmetrical arm swing, yeah? So using the poles, like Urban Poling is a company, I work with them. I'm sure there's other pole-based companies. You could probably even just get cross-country skis and right, you're doing it. What they do is they force that reciprocal pattern, which forces the trunk to start rotating. Another product, it's called Smovey, 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 and it is a green loop, like this, about this big, a green loop that you hold on to, and you have one in each hand. And within this green loop are little metal balls, and there's ridges within the device. So as you swing your arms, the little metal ball is hitting and rubbing against the ridges, creating, guess what? Vibration. So now you're swinging and you have the ball bearing going, and then you feel the vibration through your hand and there's weight to it. Yes, amazing. It forces you into this reciprocal pattern. Oftentimes, you know what I see is that if you just get the arm swing fixed on an individual, their gait will fix. You will actually start walking at a pace and in a pattern that reduces falls and it feeds the nervous system. So SMOVI is the other one. Okay, so we have urban poling to get the arms. We have SMOVI, which is the green cylinder that you're holding onto, right? And you'd be walking with that. Now, if you don't want to do that, guess what you can use? Wrist weights. Yeah, get wrist weights. So there's so many, they're fashionable. There's some right now. Shopbala.com has wrist weights that they look like fashionable bracelets, like they would be an actual fashion item, and no one even knows that you're using them to create some weight to your arms, gravity, so that you can swing your arms better. Super cool, right? And you get a little fashion statement at the same time. So that's something that I really like to optimize arm swing. Okay. Now, other products that I like to optimize noise from the feet. This one, again, I founded Naboso, so I'm definitely giving that disclosure, but it's called Naboso insoles, Naboso insoles, and they are textured insoles, little pyramids across the entire insole that you put in your shoes, and it stimulates the nerves in the bottom of the feet. Super simple, super easy. We have videos on our website of people before and after, like immediate after, and they have a symmetrical gait again. They're walking faster, which means they're going to reduce their falls. So again, you want to think of bringing in that input through the bottom of the feet. Naboso insoles, textured insoles. Another one that you could do is vibration, which we've spoken about before so many times. Whole body vibration. PowerPlate is a company that makes a vibration platform. So it's about the size of like an aerobic step, and it vibrates, and that wakes up the nerves in the bottom of the feet and allows you to walk better. Great tools that I like to use. Try to get that stimulation through the feet, get the stimulation from the hands, train your eyes, train your ears, right? Use devices that help with reciprocal arm motion. Okay, now let's go into just a couple more tips. And if you guys have any questions, I would be more than happy to answer those so that we can get you the goals that you want. Okay, here we go. Next topic that I'm going to speak about is dual tasking. So now one of the most important things when you start to bring in the sensory input is you have to train your brain to process information at the same time as you walking, right? So walking should be subconscious. You don't think about it. If I'm going from my chair across the room, I want to be able to just stand up and go, right? I don't want to think, okay, stand up, engage my core, put my foot down, bring my leg forward, swing my arm, right? That's a lot of stuff. Your brain just can't think consciously of all those things at once. So we need to get all of those things subconscious. What gets all of those processes subconscious is sensory. I hope that that is the biggest takeaway, sensory. Yeah. Feet, shoes, Naboso, vibration, hands, stimulation, use your eyes, stimulate the ears. Great. Yes. Now, once you're walking, if that subconscious pattern is happening, now we have to start making decisions. So let's say you're going for a walk and you're walking with your husband or your child or your best friend, and you're taking a walk, and now there's a hole in the middle of the sidewalk. You have to make a decision. How are you going to get around that hole? Are you going to go around it? You're going to step over it, right? There's this conscious, you might not realize it, but there's a decision process that is happening while you are doing all the demands of walking. This is called dual tasking. This is one of the most important skills that you need to train to reduce your falls and improve your balance when you're walking. How do you dual task, multitask, if that's easier for you to understand that, okay? So what you do is you do brain games while training your balance. You may have done some of this at some point if you've ever gone to formal rehab, that they've done this. So now there are a few examples that I have on a slide of what you can do. So let's say you're doing a balance exercise. I'm just going to stand on one leg for the sake of this. And while I stand on one leg, I'm going to count backwards from 100 in multiples of 3 or in multiples of 7. Yeah. So now I'm forcing a cognitive task while you are doing a balance task. Okay. Some other things that you could do could be spell a month backwards, say the months backwards. I give you a word and you spell it backwards. You can, recollect states. You could kind of visualize driving from your home to the grocery store, and you're going to say it out loud that I'm going to come up there and then I'm going to turn right on Main Street and then I'm going to turn left after 3 blocks, and you're kind of seeing it in your mind. Those are challenging different aspects of memory recollection and decision making. This is while doing a balanced task. What's super fascinating when you look at dual tasking is that if you look at concussions or you think of TBIs, like even a TBI from a motor vehicle accident or a severe fall, doesn't have to be like a sport associated concussion, is you will have the individual demonstrate decent balance, right? So the way that you're able to say like, okay, you're good from the concussion or the TBI, you're good to go, you're cleared, right? Let's say it's a football player, you're good, go back into the sport, okay? But as soon as you take that individual and you put them into a dual task situation, you will often see a dramatic decline in their ability to stabilize. If we stay with the sports section, NFL or football that has very high concussion rates, this is what they're seeing, is that a lot of these athletes are returned to sport too fast because they're never really assessed under a true dual task. They would just be challenged over here cognitively and then over here from a balance perspective, but never put them together. And it's when they're put together that the stability drops. And then the reconcussion rate for these athletes, unfortunately, is very high because of that. Let's take that to our own situation. What could be really contributing to our complication when it comes to returning to movement and day-to-day function is that maybe we haven't optimized that dual task. What I encourage you to do is that when you do your brain games, when you're doing balance exercises, is you need to make sure, check the box, is all of my sensory input as high as I can? Is something in my hand? Am I barefoot? Am I standing on an Aboso mat? Am I on a whole body vibration platform? Is the light appropriate? Am I looking and using my eyes? And now let me recite backwards the months. That's the way that we want to do it. When I look at rehab, neuro rehab for my chronic patients or movement disorder patients, is I shape everything in a way that I want their nervous system to win. I want you to win. I want your nervous system to win. I don't want to put you on an unstable surface and have you do these complex tasks and then kind of say like, figure it out, right? That's not fair. That's not fair to your nervous system. We need to understand how to give your nervous system as much information as possible so you and it wins. That is always my goal. And that's why I teach and I lecture at things such as this so that you know how to help your nervous system win. Sensory is how your nervous system wins. Excellent. Beautiful. Are there any questions? Any questions at all? If not, I want to talk really briefly about footwear that can help you. And then we will kind of see if there's other questions, and then we'll kind of kick it off and I'll have you do maybe some homework. I'll give you some homework. So let's talk about shoes. Now, a lot of people come into my office asking about the best shoes that they should be wearing just kind of day to day or when they do their exercises. We often think that when we have, chronic conditions, whether it's neuropathy or MS or you have foot drop or anything like that, that we need more stabilizing footwear, that we need to have more structure. We might need an orthotic. Some of us do need to have an AFO or an orthotic. But there is an advantage to having more minimal shoes, that you can feel the ground more, that you can actually twist and turn the shoe, something that's a little bit wider in the toe box. So this is actually where I started to move a lot of my chronic patients into minimal shoes. And then the way that I upregulate their awareness to the ground is that I use the Naboso insoles. So some of the brands that I use, again, it could be any that you're partial to. Vivo Barefoot makes minimal ones. Zero Shoes, XERO Shoes is another minimal brand footwear company. New Balance makes a New Balance Minimus, which is a minimal shoe. You're essentially taking away the cushion and decreasing it. You're providing a little bit of a decrease in the structure so that you can move the shoe. Again, sometimes we think that this is counter to what we need, but my goal is to have you feel the ground, connect with the ground. The more that you can connect to the ground, the better you can anticipate the ground. And then the more you can anticipate the ground, your reaction time is actually higher. So perhaps your fall risk will go down, your ankle sprain risk could go down, right? I often say that we are only as stable as the rate at which we can sense a shift in that stability. Yeah, let me say this again. So I'm only as stable as the rate at which I can perceive a shift in my body, which means I have to be very sensory sensitive. The faster I can sense that shift, the faster I can correct myself. Research shows that the more minimal shoes, the faster you feel the ground and you get that stimulation. Of course, protect yourself, use the Naboso insoles, or if you have an AFO or you have an orthotic, you can still put those in those shoes 100% and still get that optimized movement. Okay, so again, moving towards something more minimal and then listening. I have a patient that I just saw in my office, this is before COVID, that I just saw in my office. She has CMT or Charcot-Marie-Tooth. So she has a foot drop and her foot is more rigid and she has neuropathy and a history of ankle sprains. So kind of complex when it comes to a foot presentation and a stability presentation and a gait aspect. So very rigid. Obviously she has a foot slap, so she's kind of hitting the ground like this. Foot is more high arch, so she has a neurological foot because of the CMT, right? So it starts to come up like this and her digits are contracting. Classic neurological foot, which means it's more rigid. So she's pounding the pavement with a rigid foot. Fracture risk is very high. And then because she has the increasing arch, she's actually rolling to the outside of her foot, and obviously it's very easy to sprain her ankle. We got her out of her orthotics. She was actually in an orthotic that was overcorrecting her and throwing her way more into this inverted on the sides of her feet. No wonder she felt awful. She had terrible IT band issues and perineal issues. Got her out of her orthotics. That was step one. So happy, so happy. And then two, I got her out of her structured shoes and into minimal Vivo Barefoot. I put her into the Naboso insole. We did daily myofascial release, trigger point release to the bottom of the feet, trigger point release to her perineals all the way up into her lateral hip. When you do trigger point release and you have more spastic chronic conditions, you want to use vibration to down-regulate the nervous system. So we use a foam roller that vibrates. Hyper Ice makes one that vibrates. So she would get a better release. And then we do daily balance exercises where she's not looking at her foot. She's looking up. She's doing them barefoot. She's doing them on the Naboso mat. And she's doing the brain training that I had referenced to you. And then when she walks, because she's in the minimal shoes, because she's in the Naboso insoles, and I taught her to actually listen for that auto feedback or that auditory feedback of how she's walking, she is so much better. She's actually reconnecting to her movement in such a fabulous way. I'm so happy, and that's what I really want more chronic patients to start doing, connect to their foundation. So here we go. Let's get into some questions. All right. So do you have balance exercises that don't require special equipment? 100%. If you go to my YouTube channel, which is youtube.com/EBFA Fitness, I have tons of barefoot balance exercises. Actually, a majority of what I have my patients do are just a series of single leg, barefoot exercises that incorporate foot to core. So you engage your foot, and every time you engage your foot, I want you to engage your core. I want you to exhale. There's an exercise called short foot on my YouTube channel, or if you just Google Dr. Emily Shortfoot, you will get tons of information on this, on how I teach people, no tools required, barefoot balance training with short foot, foot to core, and breath. 100%. If you cannot find that, Deanna, just message me directly and I will send you some direct links for that, okay? Excellent, great. Any other questions on this? I hope that you guys are learning. I hope that you are engaged. If you've been curious to learn more about barefoot and bringing sensory information in, then hopefully this has just further piqued that curiosity and you are ready to learn more. 100%. I have a book called Barefoot Strong, which is available on Amazon, where I go into everything about barefoot science and how you can take your health into your own hands by understanding what is your foot type. How do you incorporate sensory information from the feet? How do you make better footwear decisions to optimize your movement? And again, blogs, YouTube, tons of information. So what else can you do to, if you get dizzy during exercises? Yes. So a lot of the dosage of what's happening. So if you get dizzy, whether it's vertigo related or other vestibular issues, is one, make sure you're optimizing the amount of sensory information coming in, right? So maybe we have to upregulate the skin on the bottom of the feet or the joints or the visual to kind of downregulate the vestibular if you're getting dizzy. Two, we want to make sure that we are doing an appropriate dose. This is very important when it comes to eye exercises and vestibular exercises, is you don't want to do, 30 minutes straight of eye movement exercises. You actually want to do, just like a couple, 5 minutes. See how your body responds and your nervous system responds. And then you slowly upregulate from there. Remember, we're trying to work with neuroplasticity and neuroadaptation. So smaller doses consistently is actually better than larger dose, let's say 2 times a week. Yeah. Most of the programming I give my patients is 5 minutes a day, 5 minutes 2 to 3 times a day versus 30 minutes twice a week. Yeah. Just try to keep that as well, as small doses. Consistency is very important when it comes to the nervous system. And then I hope that helps you, Sharon. Okay, excellent, good. Well, my links have been typed in as far as my YouTube channel, youtube.com/EBFA Fitness. And then again, my book is Barefoot Strong. You can find that on Amazon. And then if you have any questions that you might have, I make myself readily available for patients and individuals. You can check out my practice, which is just my name, dremilysplichal.com. So my name, just type that in, it's the URL. And then I do see patients virtually. And like I said, make myself very accessible to you. I'm on a mission to help people improve their movement and optimize what I call movement longevity from sensory science and barefoot science. I hope everyone has an amazing day, amazing week, and I will hopefully speak to you soon.